Good morning, assessors. My name is Camilo Gilabert. I am the treating physiotherapist for my patient Caroline Kisner. She is 55 years old. She was diagnosed with triple negative breast cancer on the right breast. She underwent 10 rounds of chemotherapy, and in the 28th of May she underwent with an ultrasound which showed hypoechoic mass on the right breast. And the following ultrasound showed 2 calcifications which were suspicious of malignancy. And because of that, the oncology team decided to do a modified radical right mastectomy plus an axillary node dissection on the 29th of May. She was diagnosed after that with infiltrating ductal carcinoma on the right breast, and the surgery was a right modified radical mastectomy plus axillary node dissections. From the physical examination chart, we can see that she is in general good general conditions. Only calls the attention the mild swelling of the right arm and hand, and the incision was without drainage. This mild swelling opens the discussion to obviously the alertness to avoid any lymphedema of the upper limb, because obviously the surgery, mastectomy plus the node dissections. From vital sign chart, all the vitals are within normal range. Only calls attention the pulse, which is a little bit in the higher end, 104. Respiratory rate 22, was 97 SpO2 on room air. Pain was 5 out of 10, and she was under tramadol orally. The right upper limb was 39 centimeters and the left upper limb was 37. The labs, we don't know the time and date, but only call attention on the glucose, which is 68, that was in the lower end. Hematocrit was 33%, which is low, but something that we can expect after surgery. Same with hemoglobin, which was 11 grams per deciliter, was low, but obviously after surgery something that we can expect. And platelets as well was 100,000, was low, obviously, and something that we can expect after surgery. And it's all these things are things that we need to keep in mind at the time that we are going to mobilize our patient, to avoid any complication of this mobilization or any bleeding that we don't want to have on this patient. The white blood count was 1.5, which is really low, but obviously something that we can expect after chemotherapy. Physio notes says that the patient is motivated but anxious at the same time. She's an avid runner but kept walking during chemotherapy. Mobility wise, she needed supervision on the bed and mild assistance with the lower limbs. Sit to stand, she needed supervision, was not using any device for walking. She was able to walk 10 meters with a Borg 3 out of 10 and was limited by fatigue. Social wise, she lives with her husband and 2 girls. We don't know their age, so that's something that we need to find out. She lives in a single-story house. There is 4 steps, no rails, no OT, and there is no arrangements for moving this bedroom to the first floor. Social wise, she works as a principal and now is in long leave service. From the notes, says that there is no assessment for OT, so it is essential that we perform that on our examination today during our session. Obviously for safety precautions at the time of discharge, and she was educated on post-op precautions.